manual, very handy manual, carefully curated.
So again we say the need is there. The patient's been coming in for simple refraction to us and we realize, look at it, how deviated their eyes are.
Come in. So much has developed. The softwares have come. Artificial intelligence is playing role. We need to learn this.
So we have lots of ophthalmologists over here who have joined us. We have faculty from various optometry schools. We have optometry practitioners as well as students who have joined us today. We have a very popular course rather amongst all the courses that LVB offers is the NSVVA or the non-strabismic binocular vision anomalies course, which is pretty popular and a very exhaustive and comprehensive course. So again, we take this opportunity to announce the launch of state-of-the-art vision therapy unit at MCVI.
Dr. CHAUDHRY, please.
It's really a pleasure to be amongst the people who matter for all of our children and beyond to see better. I think all of us together, in one term, if I say, it is the custodians of sight. Whether we are optometrists, ophthalmologists, or opticians, or these vision scientists, or the industries who are developing technologies to make this better. All of us have one single aim, to make sure that the children of future have good stereopsis. And stereopsis is the term which I usually find very dear to me. My whole life, I say, is a dedication, pursuit of stereopsis. That was also the title I chose for the lecture which I was invited to deliver by the American Association of Pediatric Ophthalmology and Strabismus in Vancouver. I mean, best wishes go to Monica and her team. It's really a pleasure to see. She was a student when first time I was taking her exam in the when she was a BSc optometry student, long time back. But now I see her coming up so grand. I mean, it's really a pleasure. I mean, as a teacher, the best tribute you can get from a student is that they can be sitting close to you as your colleague. And that is what I think I really wish of them. But we just need to remember there are several problems which can happen. It may be the obstacle to individual vision or an interaction between the two sides. And the modalities of treatment are many. What is now exciting is a binocular vision therapy which is now coming up. Show you the role of that optics, what it is doing. And this is something which we may be looking forward to. There are some obstacles in its full use right now because children need change. Thank you all for your love and affection.
Before we continue with the session, I would request Dr. Pradeep Sharma sir to kindly felicitate our esteemed guests for the day, Dr. Rizwana Hussain and Ms. Gayatri Prabhu.
The thing is, this is when binocular vision becomes super important. It's not just about prescribing one pair of spectacles or multiple pair of spectacles, but it is ensuring that they not only see single, but they get to see efficient, comfortable, clear vision, right? If you're going to be examining, let's say, 10 patients, almost 3 of them are likely to have a BD issue. So unless you do your BD assessment, you can actually miss it. And we all know now this famous number, which is by 2050, 50% of the world's population is gonna be myopic.
And what is the 1, 2, 3, 4 steps of comparison between delay and modified body shape?
Modified body shape.
Because that gives a quick glance for an upcoming optometrist to have, okay, if I have to do it in a busy.
So wherever you want to push plus, you reduce minus. Wherever you want to push plus, you want to reduce the minus. Definitely bodish delayed is a starting point, okay? Maddox on the right eye, streak is also on the right side, uncrossed. And what foria it is? ESO, okay? So uncrossed or ESO. So anything on the right side you see ESOphoria, right? Anything on the left side, you see exo. So for this to work, you need to have medox in the right eye. Okay, so don't put medox in the left eye and then do this, because then it's ulta fight. So this is one that just rests on the forehead. Okay, and then you can take the target actually very close. So I use this for NPA and NPC as well.
So I'm trying to focus on how we can do a little bit extra on managing intermittent strabismus in a orthoptic way. Now these are the different phases in binocular vision therapies. Optimal correction is the key. So as again the guidelines already being discussed just now, a proper and a full refractive correction of myopia needs to be there, and most of 90% would have myopia, so that's why optimal correction is very, very adequate.
For example, in my OPD, I would ensure that we are doing a cycloplegic refraction for all the children, but we also have us a lot actually. I mean, right there, taking multiple readings on the AR exactly tells you how well he's accommodating. And in fact, for that way I found sometimes the photo has to be used. Similarly, for a basic binocular assessment, a simple thing like a Lange 2 pencil test is what we would do on the table while the kid is being examined, to be able to catch something which is there by now.
Good afternoon, everyone. It's post-lunch session, and I can see all droopy eyes. How many of you say it's case A and case B? All right. And how many of you say it is case B, only case B? Okay, good. So there's nobody who says it's only case B. Let's move about with how we check for fixations. So if this is if suppose a kid comes and you close one eye, right? If you close one eye and the child, as I said, tries to push your occlusion, then that is indicative that the eye under occlusion is your dominant eye.
So how does reverted vision does that? How does it improve? And how does it know that how to give each specific presentation to each and every patient? So the first 2-3 sessions are called baseline, where it randomly gives presentation to patient and takes responses. And that's when it determines the baseline threshold of each and every patient. Important point to note here is, yes, there is a small sample size, but yes, it is a stimulus deprived case which is said to be more adamant to change whatever you do. So it has shown a significant improvement in those cases.
But though after 8 hours of patching, after 2 months, he was still having 6.6 in the left eye, and his stereosis was still absent. So we have planned for revital. After 80 sessions of revital therapy, the left eye vision increased to 618 and the stereosis increased to 800 seconds of R.
See, the revolution what has come in optical, whereby now we got opportunity to move to selling myopia control lenses. The same technology is coming into orthoptics, or something coming into vision therapy. But now the technology is software based, whereby you pay only for the software if you take it. So that makes a lot of sense from business point of view. Whereby everything is changing to home based, everything is changing to like you just only what you need to do, either give them red and green glasses, or you tell them okay fine, this doesn't require even the red and green glasses. Patients can do it at home.
The software does the treatment and management, but the clinical evaluation and follow-up is yours. We've seen therapies not working just because you did not pick up the right case. When we had even in the morning, half of us could not diagnose.
symbols yet, right? So it's always good when you start, you always make them point to the symbols and familiarize them with the symbols first before you are actually assessing the visual acuity. Spend that 5 minutes trying to talk or building a rapport with the child when you're initially doing an assessment, and you also spend some time trying to understand what are they seeing in these symbols, or how are they comparing the symbols from the symbols that they're seeing here. Alright? And then you occlude one eye, and if somebody wants to come here as a small kid and answer, come. So we have to, one of you can come, I'll call the other person so that answer other. Okay, so we have Rakshit, who is a second year student. Alright, so now Rakshit will pretend to be a 4-year-old kid and respond to the Lia symbols where we are having it at 3 meters, right? So you can stand here.
They're aggressive.
Right? So I look at the pose, I make it single. Alright, when I look at the near beat and it is single, I can see the row crossing, right? Because I will see what do you call that? Physiological program. When I look at the distance, the near one will again cross. Alright? Okay, so this is +2 and this is -2. So if, for example, I am keeping the minus in front.
उसको माइनस में टाइम लग रहा है. डिफिकल्टी क्लियरिंग माइनस, ये ऐसे लिखा जाता है.
Plus is saying fast.
Good Light is authenticated, and Deuteron Vision is marketing Good Light products. You have other things also. So how many of you, at the end of the day, I would just ask one question. कितने लोग आज मोटिवेट हो गए हो विजन थेरेपी और बाइनोकुलर विजन के लिए? बड़ी जोर से हाथ आ रहे हैं. Thank you so much. If we have that number.
So, on behalf of MCVI and Team LBB, I wish to thank each one of you for have graced the occasion today and made this event a grand success. For all those who lifted their hands and said they are highly motivated, there's one word of advice. Today we feel highly motivated, and tomorrow probably we'll try to incorporate our knowledge and learnings. But day after tomorrow our motivation level may not remain the same. Consistency. You need to be consistent. And like Dr. Rizwana and Ms. Gayatri have reiterated that to be consistent, you don't have to do the entire bunch of binocular vision tests. You need to run a minimum battery of tests. And let's incorporate those minimum battery of tests on all our patients. That's how you remain consistent. Rather than trying to incorporate everything and trying to do all sort of crazy things and not be motivated enough, let us begin. Let us have a small step and leap forward.
Thanks a lot for MCVI, LBV, especially to, and then Dr. Anita and my elder sister, Professor Monica Chaudhary. It's been an honor to be with them all the times, and to be quite honest, the most intelligent and hardworking person in my family is Professor Monica Chaudhary. Thanks a lot, and thanks everybody for joining us today. I'm looking forward to seeing you.